Question: how can the risk of esophageal leakage be managed after endoscopic procedures? Answer: after endoscopic procedures, strict adherence to post-procedure care instructions, including dietary restrictions, helps minimize the risk of esophageal leakage. Question: what is the significance of esophageal hematoma in esophageal injury? Answer: esophageal hematoma can cause obstruction, pain, and potential compromise of the airway. It may require monitoring, endoscopy, or surgical intervention if severe. Question: how does the management approach differ between caustic substance-induced and traumatic esophageal injuries? Answer: the management approach differs based on the underlying cause of the injury, with caustic substance-induced injuries requiring close evaluation for complications such as stricture formation. Question: what is the role of endoscopy in diagnosing and managing esophageal injury? Answer: endoscopy is a valuable tool for diagnosing esophageal injury, assessing the extent of injury, and performing interventions such as stenting or dilatation. Question: how can the risk of anastomotic stricture be managed after esophageal injury repair? Answer: regular surveillance and interventions such as esophageal dilatation can help manage anastomotic strictures that may develop after esophageal injury repair. Question: what is the significance of esophageal foreign body ingestion in esophageal injury? Answer: esophageal foreign body ingestion can cause trauma, perforation, or mucosal injury. Prompt evaluation and intervention are necessary to prevent complications. Question: how can the risk of tension on the anastomosis be managed after esophageal injury repair? Answer: tension on the anastomosis can be minimized by ensuring adequate tissue mobilization, proper suturing techniques, and avoiding excessive tension during repair. Question: what is the role of nutritional support in managing patients with esophageal injury? Answer: nutritional support, including enteral or parenteral nutrition, may be necessary to maintain adequate nutrition in patients with esophageal injury and those with impaired oral intake. Question: how can the risk of anastomotic dehiscence be managed after esophageal injury repair? Answer: proper surgical technique, careful tissue handling, tension-free anastomosis, and post-operative monitoring help minimize the risk of anastomotic dehiscence. Question: what is the role of esophagography in diagnosing esophageal injury? Answer: esophagography, such as a barium swallow study, is used to assess the anatomy and function of the esophagus, diagnose strictures or leaks, and evaluate the effectiveness of repairs. Question: how can esophageal injury be managed in pediatric patients? Answer: managing esophageal injury in pediatric patients requires careful evaluation, tailored interventions, and consideration of growth and development factors. Question: what is the significance of iatrogenic esophageal injury? Answer: iatrogenic esophageal injury can occur as a complication of medical procedures. Timely recognition and appropriate management are essential to prevent complications. Question: how can the risk of esophageal leakage be managed after endoscopic procedures? Answer: proper patient education, adherence to post-procedure care instructions, and close monitoring for signs of leakage help manage the risk of esophageal leakage after endoscopic procedures. Question: what is the role of mediastinal drainage in managing esophageal injury complications? Answer: mediastinal drainage may be necessary to manage mediastinitis or abscess formation as complications of esophageal injury. Effective drainage helps prevent further complications. Question: how can the risk of anastomotic leakage be managed in esophageal injury repair? Answer: proper surgical technique, adequate blood supply, tension-free anastomosis, and regular post-operative surveillance help minimize the risk of anastomotic leakage. Question: what are the common causes of esophageal injury? Answer: esophageal injury can result from trauma, foreign body ingestion, caustic substance ingestion, endoscopic procedures, and underlying medical conditions such as gastroesophageal reflux disease (GERD). Question: how is esophageal injury severity assessed? Answer: esophageal injury severity is often classified based on factors such as the depth of injury, extent of tissue involvement, and the presence of associated complications. Question: what are the clinical signs and symptoms of esophageal injury? Answer: clinical signs of esophageal injury may include chest pain, odynophagia, painful swallowing, dysphagia, difficulty swallowing, hematemesis, vomiting blood, and signs of infection or sepsis. Question: how can esophageal injury be assessed during a physical examination? Answer: physical examination findings for esophageal injury may include chest tenderness, subcutaneous emphysema, crepitus, and signs of systemic infection or sepsis. Question: what imaging studies are commonly used to diagnose esophageal injury? Answer: imaging studies such as contrast-enhanced computed tomography CT scans, barium swallow studies, and esophagogastroduodenoscopy EGD can help diagnose and assess the extent of esophageal injury. Question: what is the initial management approach for a stable patient with suspected esophageal injury? Answer: the initial management approach for a stable patient with suspected esophageal injury involves supportive care, pain management, fasting, and diagnostic imaging studies. Question: what is the primary concern in managing esophageal injury? Answer: the primary concern in managing esophageal injury is preventing complications such as mediastinitis, sepsis, and strictures. Timely diagnosis and appropriate treatment are essential. Question: how does the management approach differ between non-operative and surgical management of esophageal injury? Answer: non-operative management is favored for minor injuries, while surgical management is indicated for severe injuries, significant contamination, or signs of mediastinitis. Question: what are the indications for surgical intervention in esophageal injury? Answer: indications for surgical intervention in esophageal injury include severe injuries with perforation, contamination, mediastinitis, or signs of systemic infection. Question: how is esophageal perforation repaired surgically? Answer: esophageal perforation is repaired surgically by isolating and repairing the perforation, debriding necrotic tissue, and providing a tension-free anastomosis if necessary. Question: what is the role of esophageal stenting in managing esophageal injuries? Answer: esophageal stenting can be used to manage strictures or leaks following esophageal injury repair. Stents help maintain luminal patency and promote healing. Question: how can the risk of infection be minimized in esophageal injury management? Answer: administering antibiotics, practicing meticulous surgical technique, and proper wound care help minimize the risk of infection in esophageal injury management. Question: what is the role of esophageal diversion in managing severe esophageal injuries? Answer: esophageal diversion involves creating an esophagostomy or jejunostomy to allow the injured esophagus to heal without the constant passage of food or saliva, reducing the risk of leakage. Question: what is the significance of esophageal stricture in esophageal injury repair? Answer: esophageal strictures can develop as a complication of esophageal injury, leading to dysphagia. Regular surveillance and interventions such as dilatation are necessary to manage strictures. Question: how can the risk of mediastinitis be managed in esophageal injury repair? Answer: proper surgical technique, thorough drainage, appropriate use of drains, and effective control of contamination help minimize the risk of mediastinitis after esophageal injury repair. Question: what is the role of esophagostomy tubes in managing esophageal injury? Answer: esophagostomy tubes can be used to divert esophageal contents away from the injured area, allowing healing and preventing leakage. They are often temporary measures. Question: how can the risk of anastomotic leakage be minimized after esophageal injury repair? Answer: to minimize the risk of anastomotic leakage after esophageal injury repair, careful surgical technique, adequate blood supply, and tension-free anastomosis are crucial. Question: what is the significance of Borges syndrome in esophageal injury? Answer: Borges syndrome refers to a complete transmural rupture of the esophagus, often due to forceful vomiting. It is a severe and life-threatening form of esophageal injury requiring immediate intervention. Question: How can esophageal injury be managed in patients with compromised immune systems? Answer: Patients with compromised immune systems require careful management of esophageal injury, including tailored antibiotic regimens, aggressive infection prevention, and close monitoring. Question: What is the role of tissue sealants in esophageal injury repair? Answer: Tissue sealants can be used to reinforce sutures, promote tissue adherence, and reduce the risk of anastomotic leakage or fistula formation in esophageal injury repair. Question: What is the significance of esophageal fistula in esophageal injury repair? Answer: Esophageal fistula, which is an abnormal communication between the esophagus and surrounding structures, can lead to leakage, infection, and other complications. Efforts are made to prevent and manage fistulas. Question: How does the management approach differ between traumatic and non-traumatic esophageal injuries? Answer: Traumatic esophageal injuries often require prompt surgical intervention, while non-traumatic injuries may be managed conservatively or with less urgent surgical measures. Question: What is the role of tissue coverage techniques in managing esophageal injury repair? Answer: Tissue coverage techniques, such as muscle flaps or omenoplasty, can be used to provide additional vascularized tissue coverage and promote healing in complex esophageal injuries. Question: How can the risk of anastomotic ischemia be managed in esophageal injury repair? Answer: Adequate blood supply to the anastomosis is essential to prevent ischemia and anastomotic leakage. Careful surgical technique and minimizing tension help maintain blood flow. Question: What is the role of esophageal dilation in managing strictures after esophageal injury repair? Answer: Esophageal dilation is used to manage strictures that may develop after esophageal injury repair. Gradual dilation helps maintain luminal patency and improves swallowing function. Question: How can esophageal injury be managed in patients with coexisting medical conditions? Answer: Managing esophageal injury in patients with coexisting medical conditions requires a multidisciplinary approach, considering the impact of the condition on treatment and outcomes. Question: What is the significance of esophageal dehiscence in esophageal injury repair? Answer: Esophageal dehiscence refers to the separation of sutured or stapled tissue after repair. It can lead to leakage, infection, and other complications, necessitating prompt intervention. Question: How can the risk of anastomotic stricture be managed after esophageal injury repair? Answer: Regular surveillance and interventions such as esophageal dilatation can help manage anastomotic strictures that may develop after esophageal injury repair. Question: What is the significance of cervical esophageal injuries? Answer: Cervical esophageal injuries are often associated with airway compromise and require immediate evaluation and management to prevent further complications. Question: How can the risk of aspiration be managed in patients with esophageal injury? Answer: Proper patient positioning, adequate airway protection, and monitoring for signs of aspiration help manage the risk of aspiration in patients with esophageal injury. Question: What is the role of endoscopic ultrasound EUS in diagnosing and managing esophageal injury? Answer: EUS can provide detailed imaging of the esophagus, assess the extent of injury, and guide interventions such as fine needle aspiration or stent placement. Question: How can esophageal injury be managed in the setting of a polytrauma patient? Answer: In polytrauma patients, a systematic approach is necessary to manage esophageal injury in conjunction with other injuries. Airway protection and hemodynamic stability are priorities. Question: What is the significance of esophageal hematoma in esophageal injury? Answer: Esophageal hematoma can cause obstruction and potential compromise of the airway. It requires close monitoring and intervention if severe. Question: How can the risk of anastomotic leakage be managed after endoscopic procedures? Answer: Proper patient education, adherence to post-procedure care instructions, and close monitoring for signs of leakage help manage the risk of anastomotic leakage after endoscopic procedures. Question: what is the role of esophageal manometry in evaluating esophageal injury? Answer: esophageal manometry assesses esophageal function and motility, providing valuable information about the functional status of the esophagus following injury.